needs of homeless families and their children. Learn about ways you can help and learn about partnership opportunities at www.familypromiseofmc.org or call our day center at 936-441-8778.
Thank you for listening to Lone Star Community Radio. This program was broadcasted and recorded live from the LSCR studios in downtown Conroe, Texas. Lone Star Community Radio is supported by listeners like you. Donate and sponsor today. For more information on getting involved with Lone Star Community Radio, contact us at lscrstudios@gmail.com or visit us online at www.irlonestar.com.
You are listening to Lone Star Community Radio on 104.5 KCZW LP Conroe and 106.1 KZCC LP Conroe, and worldwide on irlonestar.com.
Good morning, ladies and gentlemen, and welcome to this week's edition of the Weekly Business Hour. I'm Rick Schisler. I'm your host. I'm also a Silver Fox advisor and the founder of OneBestConsult.com. We're coming to you today from the studios of Lone Star Community Radio, which is located downtown Conroe, Texas. Conroe is the county seat if you live outside the county and don't know that. So it's always bustling, lots of things going on. And quite frankly, business here in Montgomery County is always on the move. One of the places in the country that has truly been blessed with lots of business, lots of opportunity, regardless of what's going on outside world and the things and the challenges. So you're in the right place if you want to talk business. Lone Star Community Radio is a community radio station. It's a nonprofit station that brings all kinds of content to you. If you're local, you want to do a show, just come in and talk to the station's general manager, Dick Schisler, and he will set you up, discuss with you, and if everything works out, you're on the air talking about what is important to you. I want to get a quick thought. As I like to start the show, it's kind of interesting. This talk of tariffs, we're small business people, right? I grew up in small business. Most of you are small business owners, managers, or people who want to be in business. And they say, well, tariffs, that's a Washington issue. That's a world issue. Well, the reality is, and there's been so much written about the current situation, is the president going to implement tariffs? If so, what's going to happen? And when you start reading some of those articles, which I'm sure they're true in the facts they provide, but the ripple down effect is going to reach down to the smallest, most distant corner of our country, right, wrong, or indifferent. I'm not for or against or anything, but the key is in your business, you need to take a look at what will happen, because I dare say that most of you have never thought about where you get products, where you get certain services, and if it's connected overseas in any way, you stand a good chance of being impacted. Typically, the most impactful thing is higher prices. And the problem today with higher prices is you got to raise the price to your customers. And right now, people are sick and tired of high prices. And it's no doubt about it, they're aware when prices go up. And it's impacting a lot of consumer businesses, but it's also impacting industrial businesses, service business, such as plumbers and electricians, because you and I both know that when people begin to talk more about your high price than what you're doing, your service, your product, then you're in trouble in the long run. So take a look at what the impact, prepare if you can, find alternate solutions, products, supply, whatnot that you need in your business. But the key, be prepared, because if it happens, when it happens, it's going to sneak up on some people, really is going to sneak up on them. And when they get that first invoice from a vendor that your price has gone up 25% or more, it's going to shake them, no doubt about it. So don't be one of those who gets shook. Weekly Business Hour is the right place if you're interested in all the latest business news, which we just touched on, getting ideas to improve your business, and participate in conversations that can make a real difference in your business. And along those lines, participation, I want to make you aware. drop me an email if you've got a question about something we discussed today or on any show, or you've just got a business question and you want some information. I respond to all the emails I receive, and on occasion we do an email bag segment where we pull a question, a topic that someone has submitted, and we talk about it on the air. So please, email address, very simple, Rick, R-I-C-K, at irlonestar.com. That's Rick at irlonestar.com. And before I forget, if you're one of those kind of people that's visual, like I am, you can watch today's show as well as listen. Simply go to YouTube or Facebook, look for the Weekly Business Hour page, and click on it, and you will see us as well as hear us. So that's there for us visual people. Well, let's get to the bottom line of this show, the real nuts and bolts, the real reason that we're here today. And that is to talk to people out there in the world, in the business world, that are doing things. They all have a great business story to share. And I dare say that our guest today has got a wonderful, wonderful business story to share with us. And I want to welcome to the studio Mr. Gene Thomas. Gene is a former Vice President, Chief Information Officer for the Memorial Hospital of Gulfport, and he's the founder and CEO of Thriving Populace. We're going to talk about healthcare and some related issues, which is it's a big topic. It never stops being a big topic, does it, Gene?
Never does.
It's amazing. It's amazing. Well, Gene, tell us a little bit about your background. What brought you to where you are today?
Sure, Rick. Thank you. And it's an honor to be here and a pleasure. So thank you for the invitation. So I'm a former technology executive, started with some very small companies that grew into very large is a relative term, but multi-billion-dollar companies. Then I accidentally got into healthcare 25 years ago. And then I accidentally became a vice president, chief information officer. Now, I didn't come from healthcare, which often people tell me is good because I have a different lens and a different perspective. And I got into healthcare and I got very concerned about a number of topics that we can discuss today. Largely, it is the cost of healthcare, certainly for businesses large or small, more troubling for those that are small. It is also the fact that our healthcare system in America, some of us that are in healthcare call it our sick care system as opposed to healthcare. And I can give you an example as to why. If you look at what I call the basket of chronic conditions, so what are chronic conditions? Diabetes, hypertension, congestive heart failure, or CHF, COPD. All of those diseases, other than genetics, they're all preventable if consumers, people like me, I'm not clinical, if we will follow a physician's plan of care. And if the collective we, in air quotes, miss the prevention window and somebody gets a chronic condition, the majority of the chronic conditions are controllable if consumers will follow a doctor's plan of care and do what they and adhere to the plan. That's the reality. However, unfortunately, that just doesn't happen in America. There are a plethora of credible third-party sources that anybody can look up. It's an easy search that shows that chronic conditions, diabetes, high blood pressure, what we call hypertension, congestive heart failure, et cetera, those are just grown out of control in this country over the past 2 or 3 decades.
Well, what you mentioned is the human factor, and I 100% agree based on my own personal healthcare journey, which has had a couple ups and downs, and but we survived and now we thrive. But that human element, what do we do with people that don't want to follow the plan?
So I've got a suggestion there. So what a lot of the insurance companies, we call them payers, are doing is they're trying to put pressure on provider organizations, which are doctors, hospitals, and health systems, to solve for this thing that we call social determinants. Social determinants are things like, why can't somebody afford their medication? Why can't somebody walk 3 times a week? Why can't somebody get a ride to the doctor's office to get their blood work done? Why can't fill in the blank? So there are some people, Rick, that have all the education, all the resources, all the money in the world, they still won't follow a doctor's plan of care. That's just fact. There are, however, some people, and I learned this being an executive at a health system in South Mississippi, there are some people who say, I would love to follow my doctor's plan of care because I do want to play with my grandkids. I do want to walk my daughter down the aisle. I just can't because I can't afford my meds. We're down to 1 car. I can't go get a ride to the doctor's office to get my blood work done. And so what the insurance companies are trying to do is make it the provider organization's problem to solve for those social determinants. That'll never work. It hasn't worked. That's not a doctor's job. A doctor's job is to get the right diagnosis. Once they've got the diagnosis, there's this thing called evidence-based medicine. and they can apply. And as long as the patient follows evidence-based medicine, I call them consumer patients. I always say, remember, patients were consumers long before they were patients. So let's treat them like consumers. But the big story is these social determinants, while very important to solve for, it shouldn't be the provider organization's challenge or job to solve for those. That's a society issue.
You know, you make an interesting point, and I hope people are picking up on it, because when we own a small business, healthcare is part of that. A lot of small businesses, unfortunately, at least in my experience over the last 40 plus years, can't afford or think they can't afford traditional private healthcare insurance or programs. And I 100% agree with you, just based again on my limited experience as a business owner, so on and so forth, and my personal health situation, is the system itself is just misdirected. It just points in the wrong way. And I, no doubt, my father-in-law was a urologist, a really good one apparently, according to his peers. And when he retired at 60, it was because one of the reasons was, even back then, of trying to deal with the system. He was all about healing sick people. That was his focus. Maybe that's old school. It shouldn't be, but the system just seems stacked. How do we as a society go about making the change or encouraging the change?
You know, Rick, if I had the golden answer to that question, I would be doing something different. It's a very challenging question. I go back to, we're going to have to figure out a way to help each other. Most physicians, like your father-in-law, only care about caring for patients. They are buried with the administrative burdens and with insurance companies telling them what they can and can't do, and also all the paperwork they have to fill out. It's fairly daunting, and I've worked in the bowels of healthcare systems. So we're going to have to figure it out as a society, and I'll tell you why. There's good, credible third-party sources, easy to look up. There's 60 to 61 to 62 million people on Medicare in America today. There'll be 80 million over the next decade because of baby boomers, people like me. There'll be 80 million people. Most of Medicare is paid for out of taxes. Every year, Medicare, there's two trust funds that fund Medicare, Part A and Part B. Every year, they have to issue a report to Congress on the financial health of the trust funds. The most recent report was May 6th of last year. There'll be a report sometime in this early spring, early summer of this year. But what the last year's report said is in 2036, it's a projection. Medicare's already saying in 2036, we can't meet 100% of the obligation of reimbursement to doctors and hospitals and health systems. They say the shortfall is going to be 11%. That's going to be a huge issue. There's 5,600 hospitals in America. Other than a few outliers that make a lot of money, most hospitals operate on single-digit, zero, or negative margin. Most hospitals, they take an 11% haircut on reimbursement, their doors are going to close. So this is something that's going to affect every one of us, every one of us. We have got to figure out a way to lower the cost per beneficiary per person. And I'll give you an example of that whenever you allow me to give that example.
Well, no, it's really a challenge. Again, back to small businesses. In small business, we want to offer health insurance, if nothing. Otherwise, it's a benefit. And when we hire, we try to maintain, train, and keep good people. And to me, one of the keystones, at least in my career, was having some kind of health benefit. And they got more and more expensive. And the trend today, right, is where the patient picks up more and more of at least the front end cost, whatever that might be. But it's jumbled up. Now, I don't think the government needs to be the main driver. They may set the plan, but it's really interesting the kind of things that you learn, like, for example, when you go on Medicare and you kind of see the system in a different light. I'm not saying it's good or bad or indifferent, but it reaches a point, and like in my case, and I have, again, some familiarity with healthcare, but on Medicare now for about 7-8 years, I don't ever worry about paying a bill for anything because I have a supplemental policy. I know my own father he was 4 months in the hospital or other facilities related. My mom didn't get one bill. She kept asking me, says, where's the bills? Where's the bill? Because she wanted to make sure she got them paid, right? Old school. But it's really interesting. It's a huge distortion, in my opinion. Where do we start on trying to unravel this and redirect it?
I think one of the important starting points is education. The average consumer, so let's talk about small business for a second. So it's a benefit. You want to give your employees benefits because it helps with retention. You also want them healthy so they can show up for work. A lot of employers, typically the larger ones, are self-insured, so they hold the healthcare financial risk. So they're at risk financially for the health. So what a lot of corporations do is they put in health improvement programs. This is nothing new. It's been going on for decades, where if the employee's healthy, they'll lower the cost of their insurance because it saves them money. It's not because they care about the employee per se, it's because it saves them money and the people show up for work. You talked about Medicare. Let me give you an example. I told you there's 60 to 62 million people on Medicare today. I ran a thing called an Accountable Care Organization in Mississippi. It's a Medicare program that they're trying to lower the cost per beneficiary. So we, the taxpayer, we spend about $15,700 per year on average per Medicare beneficiary today. When someone goes on dialysis, like my mother-in-law, that annual cost goes from $15,700 roughly to about $80,000 a year. That's what a dialysis patient costs Medicare today. Unfortunately, we have millions of people beating a path to becoming an $80,000 a year dialysis patient that the next generation of taxpayers, workers, young people can't afford. This is education. They need to be educated about this. What I tell the young people, if you find somebody in my age bracket that's not healthy, you need to get them healthy. Put a dog collar on them, walk them down the street, shove the pill down their throat, do something, because you're going to pay the cost of it when they're on Medicare. Now, Medicare is a wonderful program. I applaud what Lyndon Johnson did by making it a benefit for people over 65 that have worked at least 10 quarters, but it is costly, and the cost is going to go up pretty significantly because of the baby boomer generation.
Yeah, that's the thing a lot of folks miss, and something I don't know if it's because of my education, but I look at the statistic, like birth rates, why that's important, and so on and so forth. But when I bring it up to talk to people friends, people I meet, or even in a business conversation, those kinds of issues, which would definitely apply to Medicare and so on and so forth, it's almost like they get glassy-eyed. And that's a matter, in my opinion, of responsibility. People have got to take more responsibility. In the case of medical care, they need to dig in a little bit and get that education.
And so, Rick, you're exactly right. So one of the things that the government thought would work, and tech and insurance companies. Now, insurance companies make a lot of money. It's been in the news recently. United Healthcare and Humana and all these, they make an enormous amount of money compared to the provider organizations. But one of the things that they're trying to do is say, we're going to make sure the out-of-pocket cost is higher for the individual with the belief that they'll take care of themselves. Well, that's proven not to be the case. Most people don't understand what we call plan design. They don't understand their benefits. What is copay? What is coinsurance? What's maximum out of pocket? Those are important things to understand. So we need the average person like you and me to start to educate our citizens and our community about what this issue is. It's a very important topic. And again, when someone like me that didn't come from healthcare, I get into healthcare, I look around and I was like, this doesn't make a lot of sense. The analogies are numerous. The more people that stop at red lights, the better, right? The more people that follow a doctor's plan of care, the better. It just costs less money. It's really simple. Difficult to do because of what you brought up, the human factor. We're consumers. So let's treat patients like consumers. I go back to and repeat what I said. Remember, patients were consumers before there were patients. So let's treat them like consumers. You're going to see more and more celebrities advertising on TV and on commercials about healthcare because people pay attention to celebrities and persons of influence.
That's an excellent point. What would happen if they put a politician up there? I don't know. It might not be good.
My concern with the politicians when it comes to healthcare is they'll do what they've done over the past 3 decades. They'll make short-term bad decisions. And that's my concern. It's not a personal thing with them. It's just that's proven to be the case. If you just look at the cost of healthcare and where we stand today, the decisions that have been made in the past really haven't improved things much for the average citizen like you and me and the listeners.
Well, that's an excellent point. And, short-term bad decisions, that's a very, very powerful phrase that all of us need to be aware of going forward because like you alluded to earlier, we're all going to be affected one way or another. So, ladies and gentlemen, we're going to take our first break of the day. I hope you'll stay with us. When we come back, we're going to continue this conversation with Gene and talk about some of the social impacts and all the things that come to bear, or some of the things that come to bear, on the healthcare cost, healthcare availability, et cetera, et cetera. It's all tied together. So please stay with us. We'll be right back.
Lone Star Community Radio is looking for those who are interested in hosting their own talk show, with monthly and weekly slots available in Conroe's FM 104.5, 106.1, and on irlonestar.com. Start your own podcast, create your first YouTube channel, and be on TV. Contact Lone Star Community Radio online at irlonestar.com or call the station message line at 936-647-3776 to take your first step into the radio world.
Lone Star Boxer Rescue is a nonprofit organization serving Montgomery County and surrounding areas, dedicated to the health and well-being of the boxer breed. Lone Star Boxer Rescue is run and managed 100% by volunteers since 1999. Our main objective is to rescue, rehabilitate, and rehome boxers that come to us from many sources, including local animal shelters, owner surrenders, and strays. For more information about Lone Star Boxer Rescue, visit our website at lsbr.org.
Listen in Mondays at noon to hear Conroe news from local nonprofits, businesses, upcoming events, Conroe Park events, news stories, and information that matters to you with your host, Margie Taylor of Taylorized PR. For more information about being a guest, visit irlonestar.com/Conroe Culture.
Welcome back, ladies and gentlemen. We're in the studio today and having, I think, a wonderful conversation with Mr. Gene Thomas. Gene, right, wrong, or indifferent, I consider you in the conversation we've had previously, you're an expert on healthcare in general. And, you and I were talking about, I start thinking about healthcare and my head wants to explode because there's so many, but there's some common threads in there, some basic, simple solutions. I say simple, they're understandable in a sense. They won't be simple because you got 300 plus million people and you got to figure out a way. What is not the way to do it? Socialized medicine, is that a way to do it?
So if you look at the data, socialized medicine really hasn't worked well depending on who you ask. However, in other countries where it is socialized medicine, what they call single payer, there's still an entity, typically the taxpayer, that holds the healthcare financial risk. That's a really important concept for people to understand, is who holds the healthcare financial risk. In America, it is for people over 65 that go on Medicare, it's the taxpayer. And so the reason that'll affect all of us, Rick, that I say is, if you look again at credible third parties that publish data, there is a well-documented shortage of doctors and nurses today and a well-documented shortage of doctors and nurses in the future, which will mean access will be limited. And when people don't have access, they don't understand what condition they have or are on the way to having on the path to becoming a full-blown type 2 diabetic, or worse, they thrash their kidneys from diabetes and wind up on dialysis. And so if you don't have access to a physician that can educate you on those things, the cost goes up. As we age, it's, again, easy research to do. As we age, the annual cost of healthcare goes up because we get sicker as we age and things happen as we age. And so this is an education process for not the medical community, because they already know this. This is an education process for the rest of us, the citizens. We need to understand this because this will affect all of us. What do I mean by that? I talked about access. So there are some doctors now, specialists particularly, that if you want to see a specialist, it could be 6 months before you see a specialist. By that time, whatever condition you have could get worse. And that's going to get worse because of the shortage of doctors and nurses now and the projected shortage of doctors and nurses in the future. Those are real issues that are going to happen. Then you tie that into the fact that right now, what I say, the math doesn't work. The taxes we collect to pay for Medicare are not going to support the number of people on Medicare over the next decade. That's clear, unequivocal from multiple third-party credible sources. That is going to happen. So we need to educate each other. Now, we need to really talk about social determinants and how do we get people to follow a doctor's plan of care. And that's the real challenge because we're humans. And in our country, fast food, things like that have become, in Mississippi, we called them McDonald's moms. I know this will sound a little bit creepy, but Once I got into healthcare, and I was like, wait a minute, how come we have all these young kids under 15 years old that are type 2 diabetics and they're not healthy? And you go sit at a McDonald's parking lot or Popeye's Kentucky Fried Chicken or places like that at 4:30, 5 o'clock in the afternoon, there's long lines. It's mom and dad going through to get something for the kids to eat. There was one family I ran into in Mississippi. I was talking to one of the young kids. He was not healthy. And he was telling me that they have this thing called Fried Fridays. Whatever's left over during the week, they just fry on Friday, whatever it is. And he didn't see anything wrong with that. Now, that's not his fault, but he said, I eat fried food. We eat fried food almost every day. I'm like, there's nothing wrong with fried food. I like fried food. You just can't eat it every day.
I'm sitting here, I'm smiling now, I'm laughing. My wife and I had conversation this weekend about marketing, and that's the thing. I have a marketing background, and we've been marketed whatever, whether it's a car or it's a piece of fried chicken or whatever, and people don't seem to understand that it's all about marketing. It's all about the money in so many things. And so the idea that I can eat a McDonald's meal and that's healthy, and they're posting, right, the government, the calories and all that stuff, and that's great, but it's not really a solution. It's window dressing.
It's marketing, and Rick, like you, I have a background in consumer marketing. I did a lot of consumer marketing in my technology days. Now, we were selling technology products, but I understand consumer marketing. And that's why I tell people when they say, well, these social determinants, you talk about using persons of influence and celebrities. And I often say to people that don't understand, that's why a soap opera is called a soap opera. They were called operas before they were called soap operas. They put them on television. Well, back when the television really began to scale and they put them on television about 100 years ago, 1930s, there wasn't mass automation of dishwashers and washing machines. So people spent hours washing dishes and clothes by hand in front of this thing called a TV, watching this thing called an opera. So what do they advertise? Soap. Those of us in consumer marketing, we've been doing behavior modification on consumers for 100 years. We know exactly what we're doing. Amazon, Walmart, Target, CVS, McDonald's, we know what we're doing. That's why we have basketball stars selling Subway sandwiches on TV. We just need to do it in healthcare. And so that's what I'm trying to do in healthcare. I'm also partnering with the Dr. Kiki Adube, who's created this platform called Shared Medical Visits. So here's the way that would work. If I'm an endocrinologist and I've got a panel of diabetic patients, I can say something like this. This is an example. Every Friday from 4 p.m. to 5 p.m., I'll be online, and 100 or 200 can join. And it can be video or just audio. And when you join by video, you can reveal your identity, or you can present yourself as an avatar. And what happens is patients share success and failure stories. A patient will say, I was struggling with my diabetes, my blood sugar levels. Somebody said, I struggled with that too for years, but here's what I did about it. And the patients will share information with each other, and the doctor's there to make sure it's clinically appropriate. It's a really interesting concept, particularly when we talk about lack of access, because now we can do a shared medical visit, or we call it in healthcare group therapeutics, which really extends the skill of the physician and gets patients talking with each other and sharing those success and failure stories.
That's an interesting concept, and it goes back to education, because when you say education and you potentially are educating 300 million people and you're trying to change very ingrained habits, it's daunting. And maybe that's something that, neighborhood watch we've been talking about in our community. So our little community of 600 homes will be better protected. The threat being, in that case, a security threat potential, or maybe it's non-existent, but that's not necessarily true in today's world. But the idea that the doctor you mentioned has a community. He's built a community of whatever number of people dial in and listen or talk or get involved in the conversation. Maybe that's what we have to do, is to roll it out and start getting people. See, I believe people don't know enough about their health, just basics. It's kind of like when I went to high school, we had gym class. But if you were an athlete, you played football or whatever, that was a higher level of athleticism that you displayed. But the rest of us at least got some basic, how to do a jumping jack, all that kind of stuff. At the time, we thought, big deal. But in this case, I find people just totally ignorant for the most part, of the healthcare, the impact. Any of these discussions you're having about cost and this, no clue. And I'm talking about educated people. I mean, it's not just the lower educated, it's the whole basket of people.
Rick, you're exactly right. Look, I didn't come from healthcare. I built some relatively large companies. I knew nothing about this up until 25 years ago. I get involved and I start to dig in because I'm a data guy. And I'm like, oh my gosh, more people need to know about this. And you're right. It's kind of like the community. When somebody does a shared medical visit, you get to talk to other consumers. And again, most doctors, and it's not their fault per se, they speak in a language that most of us don't understand. But somebody who's done some research can explain it to you and me, as well as a doctor, almost easier than a doctor can, because we can put it in layman's terms. And that's really important for people to understand. When you get a lab result or you get a diagnostic X-ray, MRI, CT, et cetera, when you get those things back and you read the reports, you need to understand what they say. Now, doctors have to put them in medical terms so that colleagues can read them and understand what it is. But if you read an X-ray report or an MRI or CT, the language in there most consumers don't understand. I didn't understand it until I had to go to doctors and say, what does this mean? Tell me in layman's terms. So it's a really important topic for consumers to understand what conditions they have, but equally, if not more important, what conditions they're on the path to having. That's really important. February is Heart Healthy Month. So there's a lot of, on TV right now, public service announcements on morning shows and news shows with doctors talking about heart health, because heart health is the number one killer of people in America, is cardiac disease. When in fact, most cardiac disease is preventable. It is a lifestyle discussion. But it's pretty significant, the cost. And I've actually had the opportunity to watch open heart surgery tableside. It's pretty traumatic. It's something that I don't want, and that most people, if they saw it, you don't want it. But it's very effective.
It's funny, so the audience knows, I have habits I'm developing or have developed in the past to make sure I don't get heart disease. And my favorite, I just became really aware of it in the last couple of weeks, and I'm smiling because it is that if you take a short nap every day, 20 to 60 minutes, you're 68%, according to the statistics of this study, 68% less likely to get heart disease. So whenever my wife gives me that look, I say, well, I'm going to go take my nap. And she says, well, no. I said, just trying to work on my heart disease. That's 68%. That's a huge number. You can't walk past that. So now we have a reason to take that nap every day.
So to your point, that's a good statistic. We have enough data, we in healthcare, we now know what works and what doesn't work. We know that for the majority of the population. Taking a nap, or like myself now at age 64, just turned 64, I walk 3 miles every other day. I don't jog it. I don't need. You just walk it, and that gets your heart rate going and keeps it actually feels good. But little things like that, just done in a pattern, done on a regular basis, make a big difference. What we did 10 years ago, anybody's been to a doctor recently probably knows that they are on a keyboard a lot. It's a real pain for the doctors. It takes them away from the physical presence with the patient. That's going to change because it's all going to be voice very shortly. But now that we've digitized healthcare, we can now look at the data at scale. And now we know things like it's a 68% chance of lowering cardiac disease if you take a nap. We now know these things because it's in digital format. We can now data mine it, so to speak. And that's been a real positive, although it's been disruptive for the healthcare organization. Now, here's the way it still works, even with that. Most doctors, because of insurance, they have to see patients in 15-minute increments. And so most doctors in private practice, like your father-in-law maybe, so there aren't many doctors left in private practice. Let's start there. 70% of physicians are now employed by a health system or by private equity. But for those that are in private practice, depending on their expense structure, how many nurses they have, the cost of their rent, et cetera, their malpractice insurance, they're not making any money until afternoon. They're just covering expenses. So that's why they have to see 30 patients a day. And that's why they have 15-minute increments. It's really sad. Now, there's this thing called concierge medicine, which is coming to bear, where doctors are saying, I'm going to take a panel of X hundreds of patients. They're going to pay me $3,000 or $5,000 a year, and they can see me whenever. And that's changing, but that's all cash pay. Insurance doesn't cover that.
Yeah, I know my parents were part of that. And it's interesting you say the digital thing. Something that I've been available. My mother, her doctor is here locally in the UT Physician Memorial Hermann system. And so I take her to the doctor this past Friday, for example, and they do some x-rays because she's got some pain in her leg, and the doctor wants to try to figure out what's causing it. And then she has some blood work done, which is normal. So this is like a semi-annual checkup. Well, last night I sat down, went online to her MyChart, and I looked at the test results. There were 4 or 5 posted. I read them. I even went and Googled, like you say, some of the language to have some understanding. Now, the doctor's going to call me and go through everything, but I wanted to understand. And then, unfortunately, I wrote a short summary and sent it to my sisters who are involved in her health care as well. But the point is that, 10 years ago, 5 years ago, that wasn't possible. And for people to have that kind of access, I'm not special. I'm just in the UT Physician system, and I have that access.
So, Ricky, you say you're not special. I'll disagree with that. I'll say you're abnormal. That's a compliment, because not only did you go into the portal, which is important, everybody should know how to go to their portal from the doctor, but you went and looked things up so you could understand it in layman's terms. That's what makes you abnormal, and that's a compliment. Because you got to go, because again, the reasons doctors talk the way they do is so their colleagues can understand, because they were trained clinically on what to say. So here's kind of the big picture I tell people that often get glossy-eyed when I have this conversation. Here's what we all expect in America. You can go ask anybody on the street. If you're in America, anywhere in this country, you walk into an emergency room, we all have an expectation. There's skilled doctors and nurses on staff, that the CT and the MRI work, and there's supplies on the shelves. We all expect that. Fair? The reality is the only way that gets paid for today is when there's sick and insured patients. I talked about our sick care system. The only way that exists today, we have sick and insured patients, and I have really smart people say, no, that can't be the case. I'm like, if we didn't have sick and insured patients, that ER with the staff doctors and nurses that wouldn't exist. They're like, that can't be the case. I'm like, trust me, that's the case. We all expect it, but the only way that's paid for today, ask any healthcare executive, is because we have sick and insured patients.
Right. Well, it makes sense from a business point of view for sure. Let's kind of, as we wind down here, and we've got a few minutes left, let's talk about what you see as the key factors. I mean, first is patients need to, or first, in my opinion, need to get educated. They need to take responsibility for their health care. You don't walk into a doctor, for an example, and they tell you this, that, and you say, okay. And that's the way it used to be. Whatever he or she said, I'm on that path, but you got to understand it. We talked about some solutions for that, education solutions, which I think needs to be a concentrated program that reaches everybody, not just a few that show up at the school at night to listen to a speaker or get a plan that they can follow that's quite simple. What are some of the other factors?
So education is a big factor. Motivation is a big factor. Influence is a factor. So I'll share with you what I was trying to do when I was full-time, but I, of course, had to quit to take care of elderly parents. So I was going to take a population of patients. These are the patients that say, I do want to follow my doctor's plan of care because I do want to play with my grandkids and I do want to live a long, healthy life. There are some patients that you say, if you come into this program and agree to follow your doctor's plan of care for 10 months, and you're trying to get 10% healthier is the goal. What every doctor will tell us, if you take somebody with diabetes and hypertension, which is where I was going to start with those two disease states, why? Because high prevalence, and they're very easy to control if the patient follows the doctor's plan of care. So every doctor tells me, if you take a patient that's diabetic or pre-diabetic, or somebody with high blood pressure, hypertension, if they will follow the plan of care for 10 months, you'll see more than a 10% improvement in all the ancillary benefits. So the plan was going to be, somebody comes in and says, I would love to follow my doctor's plan of care, I just can't afford my meds. I can't get a ride, I don't know how to eat healthy, I can't walk at night in my neighborhood because it's unsafe. So the plan was going to be, if you will follow your doctor's plan of care and document it on an app that we've got, we will help you apply for all the financial aid for your medications, even then we'll pay the difference as long as you're taking them. You can't get a ride to get your blood work done, we'll call Uber Health. You don't know how to eat healthy, we'll give you a dietitian. You can't walk at night because it's not safe. We'll get you a gym membership. As long as you do what the doctor says and you document it, that's the key thing. This is all about economics, because if somebody gets 10% healthier, according to academic studies, that saves about $800 a year in claims expense. That's payer speak. Now, if you do it across a large population, that saves a bunch of money. And so a lot of this comes down to what I call claims expense, payer speak, because they hold the healthcare financial risk, and they're the ones that decide. You heard about these things called prior authorizations. They're the ones that decide, and denials. They decide. The doctor says, I need to do this patient. They're like, nope, not going to do that. We're not going to pay for that. So to answer your question, it's multifactorial, Rick. It's a whole bunch of different topics. It's education, it's motivation, it's resources. It's a combination of a number of things that are very important, yet very difficult to do, and they all got to be put together in one cohesive program.
Your experience, is this a problem we need to approach locally or statewide, or is it better left to the federal government? I mean, what's your sense of trying to roll a program out that has the opportunity to reach everyone?
So what I wanted to say to answer your question is it's all of the above. Asterisk. The federal government, when the Affordable Care Act came out, whether people like it or not, they CMS, the federal government, created this thing called the Medicare Innovation Fund, and they gave them $10 billion, which isn't that much in the big picture, out of a $4 trillion healthcare system. And the Medicare Innovation Fund, they said, I rarely give the government credit for much, I give them credit for this. The charter was simple. Go test alternative healthcare delivery models and go test alternative healthcare payment models. One of the things they came up with is this thing called an Accountable Care Organization, or ACO. I ran one in Mississippi. They give you a population of Medicare patients. They come up with a benchmark. Let's call it $10,000. If you can come in below that benchmark, now it's easy to do that, just don't see patients, and hit quality measures. If you come in 2% below that benchmark, so let's say if the benchmark's 10,000, you come in at 8,000, it saves $2,000. And as long as you hit quality benchmark, the Accountable Care Organization, the doctors and the hospitals and healthcare systems that participated, they get half of that money. And so they've tried that, and it's worked. It just hasn't worked at scale. So they're testing. They got many programs around the country. They do this thing called bundled payments. So somebody goes in for a hip or knee replacement. That's where they started. And they say, look, we're going to pay $1 amount, and you guys carve it up between the surgeon, the anesthesiologist, the tech scrubs, the hospital, what we call the facility fee. You guys figure out who gets paid what. So they're trying to do it, but I think it's more, to answer your question, we should make it more local and statewide. The federal government has too many lobbyists. Here's, again, an easy search. For every member of Congress, there's 3 pharmaceutical lobbyists for every member of Congress. 535 members of Congress, over 1,500 lobbyists, just on the pharmaceutical industry.
Wow. Well, and you make a good point, and I know it's a topic of conversation in the world without trying to be political, but what our current president's doing is sort of shaking things up, turning him over, and I smile and I applaud. I know there's going to be some broken dishes and whatnot, but the idea is that after 200 years, call it, or 250 soon, it'd be true in business. Just everything needs to be, every once in a while, shaken, moved around, dramatic change. Maybe this is an opportunity for healthcare, because it'll be in that mix eventually at some level.
Well, it costs so much money, for the federal government, which is us, the taxpayers, that it needs to be in the mix. COVID taught us a lot. Here's what COVID taught us. So we all heard that if people had underlying health conditions and got COVID, they did worse off. Underlying conditions are those basket of chronic conditions I talked about. If you have diabetes or hypertension or congestive heart failure or COPD and you get COVID, you're worse off. And again, I go back to what I opened with. Most of those things are preventable. Other than genetics, like type 1 diabetes is inherited, so you can't prevent it. You can only control it. But type 2 diabetes is, if you ask most doctors, I would encourage any doctors that are listening to ping you on this. Most doctors will tell you type 2 diabetes is completely preventable. So is congestive heart failure. But I think we got to educate people, and we've got to get some influence out there. We've got to get some people that say, I'm like you, I'm an average citizen, and I changed my lifestyle, and now I feel better, and it's costing me less money, and I'm going to live longer. Those are important aspects. Everybody wants that, just few people do it.
Right. it's kind of like, it's fun watching some of the fast food providers trying to change their mix, like serving salads, for an example. And ultimately, if this is going to succeed, they're going to have to change their mix. They're going to be forced to, if enough people obviously start trying to take better care of themselves. Then we won't want to buy that junk food, as it's called. I mean, think about that. Your product is called junk. I mean, you've got to be a marketing wizard to head into that headwind and make some sales.
It is sad because a lot of that junk food, as you describe it, which I agree, by the way, is very inexpensive. And so we've got a lot of the population that's all they can afford, or so they think. You actually can't eat healthy on a high or low budget if you take the time to get educated on what that means. You actually can do it. We've seen people do it. And food, Geisinger, which is a large health system in Pennsylvania, they've got this thing called Food Fresh Pharmacy, but pharmacy is spelled Pharmcy. So what they do, it's called for all the rights, the right patient, the right physician, the right diagnosis. As opposed to the doctor writing a prescription for a medication, the doctor writes a prescription for food. Because if people eat with certain conditions, if they eat healthy, it's as effective as a pharmaceutical. Now, the pharmaceutical industry doesn't like it because they don't get to sell the pills, but it's better for the patient, and it costs less money for whoever holds the healthcare financial risk.
Right.
And so food is becoming a big topic in healthcare because, again, I got my Mississippi experience. If you want to see what food does to people, come to South Mississippi.
Yeah. No, Mississippi is famous for a lot of different things. There's no doubt about it.
It's a wonderful place. It's just sad what happens with some of the kids that grow up and don't have any education other than fried food's okay 90% of the time.
Yeah. I sort of touched my life a little bit. That was Georgia, because my mother's family's from Georgia. So big chicken dinners and fried chicken and the whole 9 yards. Of course, it was served with a lot of love, so that accounted for something. Well, Gene, as we wind down, got a minute or two left. Tell us what Thrive is all about. I mean, that's something you founded. Tell us how that fits into this.
So I founded Thriving Populace to try to align with that Medicare Innovation Fund. The whole purpose was to create programs like 10% Healthier that were designed to lower the cost, keep people healthier, which lowers the cost. Because, again, a lot of this is about cost. Then I hooked up with Dr. Kiki Adubi, who's got a company called Wellness Wits, where group medical visits or shared therapeutics came into play. And that plays a big role in Thriving Populace and 10% Healthier. Because if we can get patients to get online with a doctor on some frequency, once a week, once every other week, and share success and failure stories. That's happening now on things like Facebook and other venues. It's nothing new. It's just sometimes a lot of misinformation. The reason you have the doctor involved is to make sure there's no misinformation. Misinformation can be dangerous for patients. So Thriving was created to try to come up with alternative healthcare delivery models and alternative payment models. Restated, let's keep people healthy, which costs less money.
Right. Makes a lot of sense. Gene, I can't thank you enough for taking time to join us. I think I've gotten so much education today, healthcare, for, again, small businesses. Healthcare costs are just astronomical in a sense that they don't have the money the big guys have to self-insure and things like that. So this is something you as small business owners and managers and that may want to implement some healthy living into your benefit program that you're able to design. And I'm sure there's some insurance brokers out there, health insurance brokers, that can help you do that and develop programs. You don't have to design it yourself. There are programs out there and available. And your workforce, your employees will be so much better off for it and hopefully would be more productive. So that's what's important in business, is being productive. Gene, if people want to follow up and have questions, ideas, want to talk to you about something, what's the best way for them to reach you?
Best way is to email me at gthomas@thrivingms.org.
And once again?
gthomas@thriving, THRIVING,
Again, thank you so much, Gene, for coming in today. And ladies and gentlemen, please put a note on your calendar. We'll be back here next Monday, 11 a.m. And please take the time to join us or listen to our video podcast of today's program, which will be posted on Wednesday of this week. You can find it everywhere in social media, Facebook, YouTube, even here at the station on their website, irlonestar.com. Click on the show tab and it drops down. It's in the morning show group, and you can listen to our programs going back quite a bit of time. We've had some wonderful guests to start this year off. I feel like I'm on cloud nine, Gene. Just wonderful people coming in talking about topics that are really germane. Until next week, as I always try to encourage people everywhere I go, stay engaged and always keep the focus, your focus, on what counts in your business. Thanks.
Lone Star Community Radio is looking